clinical presentations of acute limb ischemia and chronic. For the clinical presentation of acute limb ischemia and chronic limb ischemia, acute limb ischemia and chronic limb ischemia. So now let's start with the clinical representation of acute limb ischemia. The clinical presentation of acute limb ischemia is very simple. You just have to count the mnemonics of the 6 P's. Is it clear? The 6 P's is the clinical presentation of the acute limb ischemia. The first P is the excruciating pain. Is it clear? You have excruciating pain, and the peculiar characteristic of this excruciating pain is that it's going to be an ischemic type pain. The ischemic type pain that occurs in myocardial infarction is the same ischemic type pain that is going to occur in an acute limb ischemia in this patient. Is it clear? So we have ischemic type pain. Is a pain that is excruciating and which is squeezing in catheter. They have a peculiar characteristic. Is it clear? So we have excruciating pain in acute limb ischemia. The second characteristic that you have in acute limb ischemia after excruciating pain, the next P, the second P, you are going to have pallor. Is it clear? Pallor means that the limb is going to become pale. If you have on physical examination the limb becoming pale, you are going to have it also as a characteristic of acute limb ischemia. The third characteristic, you are going to have paresthesia. Is it clear? Paresthesia again is when you have tingling sensations. The patient tells you that he has tingling sensation of the limb. He can tell you that you have an acute limb ischemia. The fourth characteristic is that you have pulselessness. Pulselessness can also tell you that you have an acute limb ischemia. You feel for the pulses, you don't have any pulse, so it tells you that you have an acute limb ischemia. The fifth characteristic after that in acute limb ischemia, you have also the next one, which is paralysis. So paralysis can also, if the patient does not move again the limb, you have also another characteristic of acute limb ischemia. And the last characteristic of acute limb ischemia is poikilothermia. Is it clear? Poikilothermia, meaning that you compare the temperature of both limbs, the right and the left limb which is affected, and then you see that the limb that is affected is going to be colder than a limb that is not affected. That is called poikilothermia. So those are the 6 key characteristics of acute limb ischemia, and they are very simple characteristics. Now you need to go on now to visualize the characteristics of chronic limb ischemia. So now, to know the characteristics of the clinical presentation of chronic limb ischemia, you need to know that what the clinical presentation of chronic limb ischemia is going to be based on the Fontaine classification. You have a Fontaine classification that is going to be a good characteristic for the clinical symptomatology for a chronic limb ischemia. The Fontaine characteristics, you start with the Fontaine A. In the Fontaine A, you have a patient that has a chronic limb ischemia without any sign and symptom. In the Fontaine A, it is a chronic limb ischemia without any sign and symptom. Any sign and symptom. No signs and symptom. That is a Fontaine A classification. Is it clear? So if you have a patient that has a chronic limb ischemia without any sign and symptom, it is a Fontaine A classification. The Fontaine B, is it clear? It is now when you a Fontaine, this is Fontaine 1 classification. Fontaine 2 classification, it is divided into 2. We have Fontaine A and Fontaine B. Is it clear? In Fontaine A, you have chronic limb ischemia with an intermittent claudication. So you see, you are going to have a shear of intermittent claudication, meaning that what the patient has pain on exertion. So pain, so crampy pain when the patient is exerting, but that is relieving when the patient is resting. Is it clear? So in the Fontaine 2A, the patient has chronic limb ischemia with intermittent claudication when he moves more than 100 meters. So if a patient moves more than 100 meters, he has intermittent claudication. Fontaine B, if he has chronic limb ischemia plus he has intermittent claudication when he moves less than 100 meters. So that is going to tell you that it's a Fontaine 2B. Is it clear? So now after the Fontaine classification, so the third element of the Fontaine classification is that what you have a chronic rest pain. Every time that the patient already has a chronic rest pain, is it clear? The pain is at rest. It's a Fontaine 3 classification. He may have a history of an intermittent claudication after moving for 100 meters, then going after moving for less than 100 meters. And after that, it tells you that after having those intermittent claudication, you now have a resting pain. It means that it's already at the Fontaine 3 classification. And then the last one is a Fontaine 4 classification where you have gangrene. It's a chronic limb ischemia post gangrene, or when you have an arterial ulcer. So this is when you have an arterial ulcer, you have this limb ischemia. Now also among the acute limb ischemia, you have also arterial ulcer, which is going to be at the end, that I did not put it in the 6 P's. So after the 6 P's, you are going to have an arterial ulcer at the end of an acute limb ischemia. Similarly, after the Fontaine classification, you are also going to have an arterial ulcer after the 4th Fontaine classification. Is it clear? And then lastly, you can have acute limb ischemia is acute. For chronic limb ischemia is chronic. You can also have an acute on a chronic limb ischemia, meaning that you have causes for the acute limb ischemia on a patient that usually has a chronic limb ischemia. It can occur. Is it clear? So you may have a patient that has a Fontaine 2 classification having an ulcer. In that case, if you have a patient in Fontaine 2 classification after having an ulcer, you not say a chronic limb ischemia. No, resulting to the arterial ulcer. No, it's false. It is an acute on chronic limb ischemia, meaning that an acute event went on a chronic limb ischemia and then exacerbated it to produce the ulcer. I hope you're understanding. So those are the elements that you have to bring in mind in order to understand best disease order. Now, the Fontaine classification is going to be taken for the symptoms. Is it clear? Now you need to know that there are certain signs that you have to evaluate when you have ischemia or arterial obliterations. Is it clear? There are certain signs, specific signs that you have to evaluate in specific tests that you have to evaluate in a patient that has ischemia at the level of the arteries. So when you have arterial obliteration, the first test that you need to do the Berger test. Is it clear? The Berger test is very important to do in patients with arterial obliteration. How do you do a Berger test? The patients will be lying down, and then after lying down, the patient elevates the leg. Is it clear? The patient elevates the leg until a certain angle. Is it clear? So the patient, when you elevate the leg of the patient is going to feel a pain at a certain angle called the critical angle, which is measured with the horizontal. It's going to feel pain at a certain angle called the critical angle, which is measured from the limb to the horizontal. Is it clear? You measure that angle. Is it clear? Generally, when the critical angle is less than 90 degrees, it means that the patient is having